name is Alliyah St. Julius. I have sickle cell disease. I want to make the track team.
She was diagnosed with sickle cell anemia 3 months. That's how really I got introduced to the Dr. Kim at Lebanon and Dr. Hitchcock here. So they became part of my family since that journey.
So I've been a part of Aliyah's care since she was very young. I've had the pleasure of watching her grow older and becoming quite the young lady at this point. So we've taken care of her needs just basically in the primary care setting, but also like help directing her specialty care throughout her life at this point. So sickle cell disease is a chronic medical condition, so it's something that follows her throughout her life, and it can cause sometimes very serious illnesses, but also means that she needs to have regular care to try to continue to help her be healthy.
When you have sickle cell disease, your blood is shaped like a C. It literally is the shape of a sickle, and that's how it got its name. So this C-shaped blood is very hard, it's not very flexible, and with the pointy ends, it doesn't go through the blood vessels very well. So that blood instead clumps, gets stuck, and it prevents blood flow and oxygen from being delivered to the rest of the body. And that can cause pain, it can cause organ damage, it can cause infections, it can even cause stroke.
So sickle cell can have crises where they basically have very significant issues with pain. It can also cause like significant issues in terms of both their organs as well as their bones.
I'm like, she's spoiled, thinking that she wants me to pick her up all the time. And I didn't understand what was going on until I was getting frustrated as a mom, carrying her around, don't know what's going on, until it was in the middle of the night. I'm like, something is wrong. And then she was crying nonstop. I guess that time it was too late. The pain was too much for her. So I took her to the Dr. Hitchcock, to the hospital. That's when I realized she had a crisis in her hand. So that's why she couldn't crawl. I didn't know it. I was frustrating and I feel awful. Every 3 to 4 months I was in a hospital with Aliyah. Every 3 to 4 months. She can't do anything at all to an excessive without throwing her off, that she ends up in a hospital. If the weather's too cold, she goes out, she'll get into a crisis. If it's too hot, she gets dehydrated, she'll go to a crisis. If she has a cold or any kind of infection, she goes into a crisis.
Aliyah, for instance, at one point in time developed significant hip issues, for which she had to be wheelchair bound and eventually walk around on crutches for a prolonged period of time.
Sometimes when like the pain is like really, really bad, it feels like I'm getting bit by like a animal with really sharp teeth, kind of like a shark. Sometimes like in my leg, in my hip, when I first had the crisis, I couldn't walk at all at the beginning because it literally felt like my leg was getting bit off by a shark. It was really painful.
A pain episode may last until that blockage clears. So it's not uncommon for a patient with sickle cell disease to be hospitalized for 7 to 10 days.
I went through a sickle cell crisis, I think it was last year in 4th grade. It was my last sickle cell crisis I had. It was in my hip, and it caused me to have avascular necrosis of the femoral neck in my hip. So I was in a wheelchair for about 2 years. And then after, it'd been really hard for my leg to heal up, so I couldn't run for almost a year.
I bring her, I would say half dead, and I come home with her well and healthy because of the doctors and the nurses.
So pediatrics in general is a very special opportunity. And I think the Children's Hospital at Dartmouth does an amazing job of taking care of not only the pediatric patient themselves, but also their families. It is not easy to have kids to take care of kids when they're sick, but I think that our institution does an amazing job of looking out for every little need of the family.
As the social work continuing care manager, I work with patients and families that are dealing with chronic or severe illnesses to sort of help them to manage the other stressors. We have great medical teams that provide care, but I also work to help with the psychosocial supports around life stressors.
Children's Hospital at Dartmouth Hitchcock has a very family-centered approach to caring for patients. So we care for the entire family because we know that For Alliyah to be healthy, her entire family needs to be well and also needs to be able to care for her. So from the very beginning, her brother David had been part of this experience. He came to appointments early on. He learned about the disease. At one point, he was very willing to be the donor for Alliyah.
It's one of the wonderful aspects of our organization is that we actually have the ability to take care of multiple facets of all, even very critically ill children.
The communication between the team, the whole team, is exceptional. I will never, if I have to move, if there's not a Hitchcock clinic around where I'm going, I'm not going anywhere.
I'm looking forward to trying out for track in the spring because I like running, and running is really fun to me, and I would get to be doing it with a bunch of my friends. So it would be a fun experience to do with my friends, and we all could just practice together, go places together, and it would just be a lot of fun. So I think about trying to get myself up and active where I can just go play with them and hang out with them.
Alliyah has been an amazing girl to me, and now I can't even say girl, she's becoming a young woman. I've known her since infancy. I got to see her from being a tiny infant to a sassy toddler to now this beautiful young adult that she's becoming. She has overcome a lot of challenges, and she's always maintained a very positive spirit about her diagnosis and what she can do.
I'm not at all surprised that Alliyah is doing this. She is a rock star, and she is just beautiful in so many ways.
No matter how many medicines we have, there's still going to be times when she's going to be in pain. And I have to tell you, of all kids that I've ever met, she has handled that with just an amazing braveness and a good attitude, to the point where all of us have found it a very privileged situation to be able to take care of her.
She makes sickle cell look so easy. Nothing stops her.
I don't think she sees limitations. I think she sees possibilities, and she looks for ways to make things happen, even when she knows she can't do it the typical way.
There was a famous football player, Bo Jackson, who had a very similar hip injury as Alliyah. And it resulted in him no longer being able to play professional sports. For Alliyah to get herself to the point where she can actually be competitive again, despite the type of injury that she had, is absolutely incredible.
The fact that she couldn't walk, so she decided that she's going to run.
It's just great to see them flourish and become what they want and get involved in such great things. And it's not about us here at Chad, it's really about them.
You're one of my favorite patients that walks in the door with a smile on her face every time. And I think you have made all of the care team, sort of happier, stronger people by having us in your life.
Alliyah, go girl!
I just want to say thank you for helping me through all the crisis I had and saving my life.